Hello everyone, shout out to all our tiny babies. Today is World Prematurity Day. This is the day we are celebrating those our tiny babies who were forced out of their mother's womb before they got matured, and the time of maturity is usually from 37 weeks of gestation. So these babies were forced out due to unforeseen circumstances. So I'm going to take you through the journey of one of our special baby that we manage amongst other babies that we usually see every day. This is baby E. Baby E was delivered at 30 weeks of gestation and he weighs 1 kg. You can imagine what 1 kg is. 1 kg is not even up to a coconut. Some coconuts weigh more than 1 kg. So the baby was so tiny at birth. Baby E struggled and survived all the problems that he had. You can see the baby E at birth, having a lot of tubes. It was not in incubator. That is where we keep the baby until they get matured. Baby E had problems with respiration, so we had to support with oxygen and ventilator. So he was placed under ventilator for a long time, and to prevent the complications that comes with the breathing problem, the respiratory distress syndrome, where the lungs are not matured. The lungs lack surfactant, which helps to prevent the collapse of the lungs. So sometimes they have this problem with breathing, and the lungs get collapsed. Another problem they have with breathing is apnea. There's absence of respiration. Sometimes they'll be breathing and they'll stop breathing spontaneously because their respiratory centers are not well matured. So most of the time we need to tap them or put a monitor to know when they stop breathing, so we can try to stimulate them again. So problems they have were also jaundice. You can see the child under the phototherapy lamp, and the child also had recurrent anemia. Another problem we faced was multi-drug resistant sepsis, where we gave a lot of antibiotics and he was resistant to all these antibiotics until he was only one that he was sensitive to. That was tetracycline. But thankfully, the baby survived it. So please join us as we continue the series on Story About Baby E.